So, by the end of my presentation, I hope you can all understand how these images here could be the future of prostate cancer imaging and aren't just some modern artworks. Every day in Canada, 14 men will lose their lives to prostate cancer. When a man is at risk for having prostate cancer, the first step is to undergo an MRI, which looks for cancerous lesions within the prostate. This creates an extremely high-resolution image. Then, if there are any lesions found, the next step is to undergo biopsy. The biopsy is ultrasound guided, and the biopsy operator has to deal with the fusion of an ultrasound image with an MRI, and for even the most experienced operators, this is a very difficult task to ensure they've sampled the right region. If the biopsy comes back with a positive cancer result, the treatment path is clear, but negative leads to all sorts of uncertainties for the patient. It could be from undersampling, missing the region entirely, and the patient has to deal with these until prostate cancer is fully ruled out. My research hopes to make it so the lesion can become visible the first time when the biopsy is performed, and the operator will know if they're sampling the correct area. And it uses this physical phenomena that happens inside all of us every day called the acousto-electric effect. This effect essentially links the change in pressure to a change in the electrical properties of tissue. If we look at this image, we can see as an ultrasound wave passes through a region, when it's more compressed, it turns red, and when it's less compressed, it turns yellow. These correspond to the conductivities of the tissue, and what it means is, as it passes through, you can measure this change. By only adding small sensors to the needle that will be used to perform the biopsy, these changes can be measured, and the ultrasound can be used to scan the entire region, forming an image of what the tissue looks like. The reason why this is so important is because cancerous tissue is vastly different from healthy tissue due to the nutrient requirements and other growth factors it undergoes when it's forming. Using this, an image can be formed. If you look at the image on the left side of the screen, this is from a simulation that I've run that essentially images a lesion under the acousto-electric effect. At the center of the image, we see this multicolored sphere that represents a cancerous lesion. If this is successful, it can ultimately increase prostate cancer diagnosis, but it doesn't just stop there. This also works for any other ultrasound-guided biopsy procedures, such as breast cancer biopsies, and this effect even has applications in mapping out seizure patterns in the brain or cardiac arrhythmias in the heart. And overall, if used, can be used to essentially upgrade all sorts of medical imaging modalities with minimal changes. Thank you.